systems are misnamed. They are, by and large, disease systems. Medical research is, by and large, disease research. Funders of health systems look to the marketplace to provide healthcare products. Similarly, funders of medical research look to a marketplace of medical researchers, offering enticing research for them to fund. But of course, in other areas of public expenditure, governments procure the products that citizens need, and some or all of the research that they deem to be important for the taxpayer, especially where national security and resilience are at stake, including infrastructure, telecommunications, and defence. So there is a question for medical research going forward as to whether there are analogous important areas of market failure. And in an increasingly woke world, the research endeavour needs to examine its own culture. Persisting and interlinked ailments include lack of diversity, hyper-competitiveness, bullying and harassment, lack of reproducibility of research findings, and pressure to publish or perish. COVID-19 has exposed a lack of resilience in public health systems in many countries. This infection has also laid bare the effects of social determinants on the expression of disease. Although pandemic infection is at the top of national risk registers, few countries had paid the insurance policy premium for national systems of preparedness to deal with a global pandemic. The job of universities, research institutes, and funders of research is to create the conditions that will enable researchers and policymakers to deal with the challenges we face. And of course, education is arguably the most important tool of all. Many researchers are frustrated by rising populism and political conditions around the world that seem inimical to tackling the health and environmental conditions of people and the planet. They can respond in two ways. More could become politicians and policymakers themselves. If you can't beat them, join them. But for the majority, they need to dedicate their work to providing the answers to key research questions that will provide the evidence needed to help policymakers and the tools that could help them to provide sustainable and effective solutions. That is easy to say, but what does it mean in practical terms? I think it means two things. Firstly, history tells us that we must continue to fund discovery research, because by uncovering the secrets of nature, we will discover unexpected things. So the new approaches to vaccine development at the moment follow some of the unexpected discoveries made over recent decades by RNA researchers working on plant and microbial diseases. But secondly, alongside the discovery research, we must use funding catalytically to encourage researchers to work together, to listen to discuss and refine and tackle the questions of policymakers, whether these be the transmission mechanisms for COVID-19 or how to measure environmental nitrogen dioxide emissions accurately and cheaply. Many of these are questions that can only be answered effectively by multidisciplinary teams.